The skin. 2. Injuries to the skin. Here is an extract from a medical website. Mechanical injuries to the skin are divided into those caused by a blunt force, such as a punch from a fist, and those caused by a sharp force, such as a knife. Injuries from blunt forces. An abrasion, also called a graze or a scratch, is a superficial surface injury involving only the epidermis, which has been removed by friction. A scratch is linear, as in fingernail scratches, whereas a graze involves a wider area, as in abrasion caused by dragging part of the body over a rough surface. A contusion, also called a bruise, is an injury that occurs when blood vessels in the skin are damaged. A laceration, also called a tear, is a wound involving both the dermis and epidermis. It is usually distinguished from penetrating or incised wounds by its irregular edges and relative lack of bleeding. Injuries from sharp forces. An incised wound, also called a cut, is a break in the skin where the length of the wound on the surface is greater than the depth of the wound. For example, a wound caused by razor blade. The depth of a penetrating wound is greater than the superficial length of the wound. For example, a stab wound caused by a knife. Case report. Read the case report and compare it with the illustration. Case 2. A 9-year-old boy presented to the accident and emergency department after he stumbled and fell while running in a wood. He had received a blow to the head from a rock and had been scratched by bushes. On examination, a vertical laceration 1 centimeter long was noted on the bridge of his nose, just right of the midline. There were a number of superficial scratches on the right side of his forehead. His right upper lid was mildly contused. Sores. The word sore is a popular term for many different types of skin lesion, especially infected lesions. A pressure sore is a skin ulcer caused by pressure, for example, the pressure of lying in bed for long periods, also known as a bed sore or the cubitus ulcer. A cold sore is a lesion caused by herpes simplex. Note, the adjective sore means painful. For example, a sore throat. The urinary system. Urinary symptoms. Urine is formed in the kidneys and stored in the bladder until it is passed or voided. Patients may say, "I have some pain when I pass water." P. Doctors may say, "Are you having any trouble with your waterworks?" Doctor, are you having any trouble with your waterworks? Mr. Jones. Well, I do seem to have to go to the toilet more often than I used to. Doctor, how often is that? Mr. Jones. It depends, but sometimes it's very hour or even more often. Doctor, what about at night? Do you have to get up at night? Mr. Jones, yes, nearly always 2 or 3 times. Doctor, do you get any burning or pain when you pass water? Mr. Jones, no, not usually. Doctor, do you have any trouble getting started? Mr. Jones, no. Doctor, is the stream normal? I mean, is there still a good strong flow? Mr. Jones, perhaps not quite so good as it used to be. Doctor, do you Ever lose control of your bladder? Any leaking or dribbling? Mr. Jones, well, perhaps a little dribbling from time to time. Doctor, have you ever passed blood in the urine, Mr. Jones? No, never. Common urinary symptoms and their definitions. Frequency, frequent passing of urine. Dysuria. Burning or scalding pain in the urethra when passing urine. Nocturia. Urination at night. Urgency. Urgency, need to pass urine. Hesitancy. Difficulty starting to pass urine. Urinary incontinence. Involuntary passing of urine. Hematuria. Macroscopic blood in the urine. Urinalysis. Urinalysis is the analysis of urine. Simple screening tests of the urine are carried out with reagent streams, for example, clinicists for the detection of glucose. More detailed tests are carried out in a laboratory on a specimen of urine. Typical specimens are a midstream specimen, MSU, and a catheter specimen, CSU. Microscopic examination may reveal the presence of red blood cells, pus cells, or casts. Casts are solid bodies formed by protein or cells, plus signs are used in case notes to indicate abnormal findings. A small amount is described as trace. For a large amount, the word gross or marked can be used, for example, gross hematuria. When there is nothing, the word nil is common. Sugar, nil. Protein, plus. Blood, plus. There was no sugar, a trace of protein, and gross hematuria. Basic investigations of ophthalmoscopy. An ophthalmoscope allows the doctor to examine all parts of the eye: the iris, lens, retina, and optic disc. For best results, the examination is done with dimmed or lowered lights to allow the pupil to maximally dilate or widen. A topical mydriatic solution may be applied to the eye to aid dilation. The patient is then asked to fixate on target for the duration of the test. Blood pressure. A sphygmomanometer. Gauge, cuff, pump, valve. A stethoscope. Stethoscope. Earpieces, headpiece, bell, diaphragm. A stethoscope is used to hear the sound of blood rushing back through the artery. The first thumping sound is the systolic blood pressure, SBP. When the thumping sound is no longer heard, that's the diastolic blood pressure, DPT. Taking blood. During venipuncture, the phlebotomist, a technician who takes blood, inserts a needle into a vein and withdraws blood into a specimen tube, which is sent to the hematologist laboratory for analysis. Usually, the phlebotomist can find a vein in the inner part of the elbow, the antecubital fossa that is easily accessible. She may apply a tourniquet, a tight band above the site, or the patient may be asked to clench their hand to make a fist in order to make the vein more prominent. Afterwards, the patient may be asked to press lightly on a dressing, usually a piece of gauze, to help the blood to clot and to prevent swelling and hematoma. A black and blue mark or bruise where the vein was punctured. Note: a bruise is a specific mark. Bruising can be used to describe a number of bruises or larger area. The patient exhibited bruising on the right forearm.